Marie, thank you very much for the kind introduction. And I'd like to extend our gratitude to Quest for hosting this webinar. Liz and I are going to address the following objectives over the next 30 or 40 minutes. And it's largely centered around sharing our experiences in leveraging blood biomarkers in the U.S. Rowing Comprehensive Athlete Monitoring Program. So I'll begin today very briefly by introducing what athlete monitoring is and what it would include. Then we'll move on to discuss this unique collaboration among U.S. Rowing, myself, and Quest Diagnostics. Liz is going to then take the stage to discuss how we've leveraged the value of biomarker monitoring and how to and really to focus on what we've done, both at successes and ways to improve on building an effective culture around blood biomarker monitoring. And then we'll end today with a couple of case scenarios where blood biomarker information has provided some important insight from a training protocol standpoint and from a nutrition standpoint. So that we're all on the same page, I want to take a brief minute and discuss what a comprehensive athlete monitoring program or system might look like. And first, the monitoring system should be relevant to the sport, and it generally comprises 3 or more categories. In this infographic, we are demonstrating 3 that all play an important role in optimizing athlete performance and health. And so on the left side of this figure, we have external load, which are metrics related to the activity for which the athlete will be completing. And so there are technologies that can help us understand movement stress, such as global positioning systems, accelerometry, which may aid in accelerations, types of accelerations, and speeds attained. But we could also include distances, minutes, frequency of participation, as well as power, all within this area of external load. The next bucket is what I consider readiness. This could be game readiness or practice readiness. To simplify it as much as I can, it's this idea of how do you feel right now, and are you capable of performing at your best at this moment? And again, there are other technologies that can aid in providing some objective answers to these questions. That among these are heart rate variability, counter movement jump tests, a variety of psychometric scales which should be validated, as well as sleep quantity and quality. And then the last major component of comprehensive athlete monitoring is this idea of internal load, which can be thought of how the body responds to the external load of training and practice. And so it's those physiological responses we're interested in measuring, and probably the most commonly utilized one, in part because it's readily available and it's easy to understand, is heart rate responses. We could also use the rating of perceived exertion, or RPE, extending that to the session RPE. Lactate, oxygen consumption, psychometric scales are also variables that can be utilized. But one that's gaining traction over the last, I would say, 10 or 15 years in the world of athlete monitoring is the employment of blood biomarkers. And one of the reasons why blood biomarkers is becoming an important component of monitoring internal load is because the blood biomarkers provide important insight into the internal load, the physiological responses to the external load, that contemporary metrics simply cannot do. For example, heart rate is going to give you some indication of the cardiovascular responses to exercise, but blood biomarkers, depending on which type of analytes are provided in the panel, can provide insight into other physiological systems affected by exercise, such as immune function, inflammatory function, muscle status, fluid electrolyte balance, endocrine system, among others. So it adds to that objective data repository that we can tap into when we're trying to identify best decisions for enhancing athlete performance and health. So with that background, I want to transition to the first objective of today's lecture, is to just detail a little bit about this unique collaboration between U.S. Rowing and the University at Buffalo or myself. And so the way this project worked is about 2016, after the Rio Olympics, U.S. Rowing was looking for ways to gain a competitive edge. And part of what they've identified is implementing a blood biomarker testing platform within their current athlete monitoring program. And what's unique about U.S. Rowing is that it's a non-government organization or NGO with world-class athletes that train multiple locations across the country. So this is unlike athletes at a university setting or perhaps in a professional setting where there's a single training location. And this represents unique logistical challenges, not only to training, but also athlete monitoring, including blood biomarker assessment. And so with that identified need, U.S. Rowing and myself at University at Buffalo, which is a leading edge, cutting edge research institution, identified a similar desire to work together on this need to implement blood biomarker evaluation in their monitoring program. And so with the need identified, we began discussions of what kind of considerations that we would need to be able to successfully implement a blood biomarker monitoring program. And so on this slide here, we see 5 items that were of particular interest to us as we developed this component of our monitoring program. And for us to have success, we knew that the coordination of the logistics of the blood draw in connection with the flexible location of where the team would be training at in a given point in time represented a substantial limitation. And so when we were looking at potential outfitters to provide the biomarker data, this is one of the items that we specifically explored, how we can manage data collection from a multi-city perspective at any given point in time. And then, of course, the quick turnaround for obtaining that objective blood data. So the moment you draw blood, your athletes immediately want to know the information related to the blood biomarkers. And so this can create a stress and some negative attitudes to persist around the culture of blood biomarkers if it's not properly displayed in the right framework. And so this is something we learned very early on. And the turnaround time is largely dependent on the biomarkers that are included in the panel. For example, IL-6, while it's an important biomarker in athlete monitoring, it does take a little bit longer for that biomarker to be analyzed and the results to return, while other markers like your complete metabolic panel may be returned in a matter of days. And so ensuring that we could achieve the most rapid turnaround time so that we can then modify nutrition and training decisions based on that data was paramount. And so identifying an outfitter that had the quickest turnaround time was essential for us. And then as far as the trustworthy results, this was essential because anybody who's worked in research or in the laboratory setting knows that when you work with biochemical data, there's some degree of uncertainty or variance in the results. And so we wanted to ensure that whatever outfitter we went with was using industry-leading technology to ensure we can trust the results. And then, of course, perhaps the most limiting is the financial aspect of it. Being able to have the budget line item for biomarker assessment and for us to be able to develop a panel that fit within that budget line item was essential for this project to even get off the feet and running. And so these are some of the considerations that some of you who are listening might be interested in employing blood biomarker monitoring should consider and have responses to as you think about your unique situation and how you're going to employ this within your team setting. So now I'm going to transfer the call over to Liz as she's going to discuss building a culture around blood biomarker monitoring and how we have used some of this objective data to adjust our nutrition and training decisions.
Hi, everyone. So I think that it is, it's very important in order for athletes to fully buy into a performance nutrition and fueling plan that they can see or feel actionable results. And I think that the combination of biomarker monitoring with my work in terms of performance nutrition and fueling, it really paints an accurate picture to the athlete as to why they might be feeling the way that they feel. I think it's also really important in a cultural aspect because a lot of times, you know, when coaches weren't aware that there were nutritional deficiencies that might be impacting the athlete's ability to perform, they might make an assumption that it's something that the athlete can control. So being able to identify nutritional deficiencies that can be impacting their capacity is really helpful for the coaches as well as for the athletes. So how did we create this type of culture is really the question. And really, the proof is in the pudding, for lack of a better way to describe it. I think that the most clear way that we were able to exemplify the meaningfulness of these results was really in being able to identify iron deficiencies. And the importance of tracking these results over time is critical. Because it's not just one draw that's able to paint this picture for us. We need year-long longitudinal data in order to deliver the highest value for these athletes and for them to understand and for coaches to understand how the changes in their training or the changes in their nutrition might be impacting their performance. So in rowing, we tend to have specific times of year that are considered base training. So they're doing, you know, more a high volume but more aerobic style work. And then we get into other times of year where there's this intentional overreaching happening and really helping us to identify whether or not it was functional or non-functional. That's where conducting these blood draws over the course of the year helped us to understand that. So what we did was we identified 5 key times in the training cycle, 5 key shifts into different mesocycles of training, and we conducted the blood draws at either the very beginning of a cycle or at the very end of the cycle. And typically the beginning was the end of a previous one. So to reflect those phases of training, again, insurance is only covering 1 blood draw per year, which in an athlete population is not very helpful because of those changes in training and how they can impact an athlete's blood chemistry and their capacity. So collaborating with Quest enabled us to do more frequent biomarker testing, and it allowed us to identify and correct nutritional deficiencies before critical times of year. The one that I think of the most is our blood draw that we did about 4 to 5 weeks prior to our Olympic qualification regatta. So we were able to test all of the athletes, identify those that were at risk of having, either at risk of having low iron or having low iron, and we were able to correct those in adequate time for selection and then subsequent Olympic qualification racing. And we need time for this. So, you know, it takes several weeks for iron status to start to rise after identifying a deficiency, and that's if the athlete's doing supplementation by the book. So tracking these biomarkers over time also gives us the ability to look back at previous years, because training phases tend to be relatively similar. The volume might change from year to year, but for us to be able to look back at an athlete's history and know that they had a tendency to have a fluctuation in the status of a biomarker at a specific time of year, the athlete can identify how they've felt previous years at that time, and then we can actually get ahead of the deficiency by being proactive about supplementation. So tracking our biomarkers over time really gives us some clear evidence of which nutritional and training strategies are helping these players to perform at their best. So as I said, how did we create this culture? And really, the most important thing was identifying a time of day and a time of week when it was convenient for the athletes and for the coaches to do this draw. So the athletes were not completely bought in the initial phases of this. But as soon as I was able to identify that their nutritional deficiency was impacting their performance, and I was able to create a system in which they could seamlessly show up for a blood draw and have it not impact their ability to train, not impact their week, it was very straightforward to have them buy into this. In terms of discussing the value of the data for gaining a competitive edge, again, that was apparent in the way that the athletes felt and in the impact that providing these results was on them and on their performance and on their energy levels. And then delivering the timely, actionable results. So what I do is the athletes show up in increments of 10 minutes. We have a phlebotomy team come and draw them all in groups of 4, basically, every 10 minutes. And when the results come back, through the platform on Quest Care 360 portal, I'm able to actually log in and look at the athlete's results in real time with our physician and also with Dr. Pryor. And the 3 of us would have a discussion on those results the day that we received them, and I would start seeing athletes for consults the following day. They would either be, those consults would either be strictly about the blood biomarkers if the athlete has been in the program for a number of years and that's specifically what they're seeking, or it could also be weaved into my nutrition consulting and body composition testing. So it's dependent upon what the athlete needs, but generally speaking, I can get the results back to all 40 of our athletes within about a week. The testing is simple. Like I said, they show up 10-minute increments. I send them a Google document. They sign up for the times that they're going to come through. We're very transparent. It's easy and simple to send the athletes a PDF of their results, and then that can be uploaded into relevant systems, medical reporting systems, or sent through their physician. So again, making the testing simple, making it standardized, making it efficient so that the athlete knows exactly when they need to show up, they stroll in, get the draw, and then they get the results in a timely manner. It really improves their buy-in. And we have, this is an optional program for the national team, and I would say 95% of them are showing up and signing up and utilizing those results to improve their performance. So as I said previously, it's very important when we're looking at inflammatory markers and biomarkers that there is a complete day of rest. There are, as Dr. Pryor said, biomarkers such as IL-6 are going to be elevated following exercise. So it's important that those inflammatory markers return back to baseline after a rest day. And that can help us to identify anyone that might not be recovering completely. So we have the athletes come in on first thing on Monday morning in a fasted state. So I generally have them refrain from eating after 9 p.m., but most of them go to bed around 8 o'clock anyways. And then the testing window was in 10-minute increments starting at 5 a.m. So we had the whole team set up, the whole phlebotomy team. Occasionally I would actually provide them with breakfast. A lot of times they would bring something with them. But it's early enough that in Princeton, the athletes can drive to our location where we have the draw, and then they have enough time to get breakfast and go to practice. And then when we do the testing in Chula Vista, which is our Olympic training site here in Southern California, where we're at today, the athletes can literally just roll out of bed in their dorm and walk over to the sports medicine building, and within 5 to 10 minutes of waking up, they have their blood draw, and then they can walk straight to the dining hall and have breakfast and have plenty of time before practice. So initially down here it says we tested groups in 15-minute increments. Now we've synthesized this process, and it's so straightforward that we can actually do it in 10-minute increments now. And we have the Quest phlebotomy team show up about 30 minutes prior to the athletes showing up. I have all their forms printed and hand the form actually to the athlete, so when the athlete goes to see the phlebotomist, they have all the information that the phlebotomist needs to place on the testing tubes. There's a room with centrifuges on the side where the blood is spun on site, and it's placed on dry ice and brought to a testing location that's usually about 10 or 15 minutes away from where the draw is.
All right. So the next phase of the presentation is exploring the case studies of how we've leveraged blood biomarker information to help us improve training and nutrition decisions. And the first case study we're going to overview is one of Jane. Jane's an alias to ensure confidentiality of this particular rower. But Jane was returning to the team after an upper extremity injury which kept her away from the usual training. And we monitored her acute to chronic workload throughout the injury and the return to play process. And for anybody who's used acute to chronic workload ratios, we know that green bar that I'm showing in the figure on the right represents kind of that sweet spot where the injury risk is the lowest. And then anything above 1.5 is this at-risk for injury location. And so when you're working with athletes who are returning to play, particularly after an injury where they've been away from training for a period of time, their training volume, so their chronic workload volume, is going to be lower. And so as you start to ramp them back up, in this case to what the team was training at, you would expect to have acute to chronic workload ratios above the to the 1.5 level and even above. And so when we ask the question, well, how high is too high? For athletes returning to play, I'm not so sure if that's the best question to ask. Rather, how much change is too much change, and how much change in a given period of time is too much change? And these are important questions that deserve attention among researchers to help answer these questions. But in this particular scenario, between week 3 and 4, the increase in training load was 33%. And then from weeks 4 to 5, the increase in training load is 44%. So it represented a much larger increase in workload than what's recommended, the 5 to 10% increase. And so identifying that Jane is returning to play after an injury that requires some time away from training, as well as her desire to get back to training with the team as quickly as possible, and this objective data with the acute to chronic workload ratio, we sought additional objective information, and that's where the blood biomarker data really comes into play. Because remember, exercise influences all of our biological systems, not just the neuromuscular system and the cardiovascular system, which we measure very frequently, but the blood biomarkers can provide us insight into those other biological systems influenced by exercise. And so if we have an athlete of concern, we may want some objective insight into how those other physiological systems are responding to the external load of the stress of training or other life stresses that might be real or perceived. And so it happened to be for this particular athlete, we obtained a blood draw shortly after week 5. And some of the more remarkable data from that blood draw are listed here. And those that are listed, we compared this to Jane's data within herself, so leveraging that longitudinal data that we had. And then we also compared some of these variables from Jane to the team. And all the variables listed here were at least 1 to 2 standard deviations away from the team mean response for this given time of blood draw. And so when we put this in perspective, she's showing impaired anabolic responses, a poor stress response in particularly free and total cholesterol, as well as elevated muscle damage beyond what her peers are demonstrating for the same training load. And so loaded with these objective data, we identified Jane as an athlete of concern based on the blood biomarker data, the acute to chronic workload data, as well as the current situation of returning to play after an injury. And so armed with this data, we re-examined the return to play protocol and really started to have an open dialogue with the athlete to create an individualized return to play plan with particular attention to all types of life stressors for this athlete. So not just the exercise stress, but other life stresses, social stress, relationship stress, work stress, travel stress. Because remember, we can't think of the athlete's stress only coming from the exercise alone. In fact, when we consider non-functional overreaching and the overtraining syndrome, it's usually the exercise stress in combination with some other stress that causes that tipping point. And so many times we use the analogy of the budget, a weekly budget, given a certain amount of stress that an individual can withstand. And so that budget, the amount of stress one can withstand in a given amount of time, has to allot for all the stresses, including the stress from exercise. And we need to be within our budget, say in a weekly time frame, for example. It was also important for this athlete to remain with the team, have that sense of identity. And so as we look at exercise prescriptions, we started to discuss ways that we can progress and regress exercises, but remain within that team environment to maintain her identity and connectedness with her peers, which ultimately served as a catalyst to motivate her to meet her progression. And when we discuss this return to play process, what's important is not to anchor any of the outcomes on time. I think more times than not, we're setting ourselves up for failure when we do that. For example, if we said, okay, we expect you to return to team training in 2 weeks, if it doesn't happen in 2 weeks, we've now got an entirely new set of issues and stresses that we've got to deal with. So rather than make it time-based, ensure the return to play is progression-based. So being able to achieve a certain volume of work in a day or in a week, certain ability to achieve an exercise intensity and repeat intensities. You might also match the progression to the ability to achieve certain states of recovery related to internal load metrics as well, where you could also use the biomarker data there. Now, for Jane, I think with this early identification of perhaps going down the path of maladaptation, we were able to catch this early on, such that she was able to return to the team training protocol fairly quickly, but most importantly, she was able to compete and do very well at World Championships. And so this case study illustrates how we leveraged objective data to identify an athlete of concern and intervene before went down a negative pathway where we might be dealing with a more overt issue like non-functional overreaching or overtraining. We were able to prevent that through key training decisions and an intervention. So the next case study, Liz is going to take over and talk about how we leveraged biomarker data from a nutritional perspective. Maybe. Liz, are you still on?
Sorry, I had muted. So for anyone who isn't familiar with ferritin, it's a very commonly used marker for stored body iron. It is the primary form of iron that's stored inside of cells. And in healthy people, most of that iron is incorporated into the hemoglobin content of red blood cells. One of the challenges that we have is that serum ferritin is actually positively associated with inflammation, so ferritin may appear higher than it actually is in a hyperinflammatory state or in an infectious state. And then hemoglobin is negatively associated, so that may appear lower in an athlete who has chronic inflammation or is battling infection. So that's really why it's critical to not just look at ferritin, but to also look at some of those inflammatory biomarkers after rest and to, again, identify the phases of training in which these numbers might fluctuate and kind of do some digging as to why they might fluctuate. So November is typically when our base training occurs. So that would be our first draw here. You can see the team's all in a relatively good iron status. Again, there's always fluctuations, but this is the mean. January is after the athletes have their winter break. So again, they're not doing much training on the water or any training on the water. It's typically erg training, and it's a little bit lower volume than you'd see in the fall. And then between January and March is really the most intense period of the year. That's when the athletes come to train in Southern California, where they're on the water at least once a day, typically twice per day. And it's a very intense selection period. So the training volume is very high. There's testing pieces most weekends. And so what we see when the volume goes up is that iron status can come down. And that's what we that's what I've seen for several years now. So the important thing is that we can identify someone who's at risk, who has a low to moderate ferritin value at the beginning of this intense training camp, and then that we can do that again in March at the end of the training camp to really identify who either wasn't responding to the supplementation, whether that be the strategies that they were using when they were taking it, or that their ferritin tends to sit a little bit lower. We can really target those athletes and with a goal of bringing iron status back up for the final selection before World Cups and World Championships, or in this case, the Olympic Games. So really March is when we tend to see the lowest levels, and then I can get with the athlete in counseling and ensure that they're optimizing their iron availability in food and optimizing their supplementation strategies. So with the ultimate goal of bringing iron status back up and having that follow with them through the summer. Now, this relationship between iron and hemoglobin is something that is critically important to understand, and the role that iron plays in the production of hemoglobin. So we can see the patterns of hemoglobin are actually quite similar to that of iron. And we can utilize this as a way to get buy-in not only from the athletes, but from the coaches. So this was a selection of athletes that were of particular concern, whose hemoglobin was tracking along with their ferritin. And we were able to kind of follow these athletes over the course of the year and figure out when they were in a zone with which they needed to either target through their training or through their nutritional practices in order to bring that back up into a normal range. And in some athletes who are unable to bring their iron status up and who have kind of a persistent decrease in hemoglobin, it impacts their performance to the effect in which they're actually less likely to become selected to the team, and they are, less likely to perform at that top tier. Another really important nutritional biomarker is vitamin D. I think that everyone's quite aware of the role that vitamin D can play in bone health, but it's also important for muscle function, in addition to other things. But with a team that's training in fairly high latitude, they're actually not absorbing very much vitamin D from the sun, from UV, even in the summertime. So they're training in New Jersey, which is fairly far north. And typically rowers are also training very early in the morning when there's not a lot of wind. And they're also usually wearing protective UV gear in terms of shirts and leggings. And then they're also covered in sunscreen. So they're really not outside at high sun. And even if they were outside and the sun were shining, they're typically covered. So we can kind of see here how once the athletes arrive in Southern California for the winter, you can see this slight uptick in vitamin D status. And then typically we're racing, competing, training, and being selected in this July period in Princeton, New Jersey, and then we're also competing in Europe. So doing the draw in July is really important because it helps us to identify who's at a low status. So again, we can bring vitamin D status up in time for the competitive season towards the later parts of the summer. But we can kind of see these these kind of group patterns with not only vitamin D, but with hemoglobin and with ferritin. So we can bring that back to the coaches and have a discussion with them about how this might impact their performance or how their performance might help be explained by some of these deficiencies. So again, the Blueprint for Athletes for us is an absolutely critical performance tool. in my practice as a sports dietitian. It helps me to illuminate to the athletes how the foods that they choose and the nutrient density and energy density of their diet can impact their ability to adapt and to sustain high levels of performance and to help them recover. I can use this Blueprint for Athletes program to really collate all of the athletes' data rather than them going to an individual physician and only getting one blood draw. We're able to do this all at the same time. We get the results at the same time. So we create this culture around it. We're all under one roof, and this allows us to have a lot more control. Even the fact that the draws are being done at the exact same time and the assays are being done in the same lab, and that we're getting the results at the same time, it really creates this cohesiveness that I've never experienced with any other blood draw programs. And obviously, we are in the business of improving performance. This is actionable data that we're getting in real time, and it works directly in line with what the coaches are saying, what the other providers are saying, our physical therapists, our doctors, what a dietitian and physiologists are saying, and we can really advance these strategies, these fueling strategies, to help maximize the player's performance and reduce their injury risk. And we can do that in an informed way. We don't have to make assumptions that an athlete's feeling tired because they're overtrained or because they have low iron. We can do this in a way that's evidence-based and that is timely, and we actually have sufficient time to correct any issues that we have before key times of year, so we can actually improve the decision-making that we have in our nutrition counseling and in our training. All right, I think that's all I have, and we look forward to answering some of your questions about this.
Thank you, Luke and Liz. Now it's time for your questions. You can send in your question via the WebEx chat or Q&A features, or if you would like to speak to either Luke or Liz and ask your question live, our operator will review the instructions how you can ask a question. Operator?
Certainly. We will now begin the question and answer session. If you would like to ask a question over the phone, please press star followed by the number 1 on your phone. Unmute your phone and record your name clearly when prompted. Your name is required to introduce your question. To cancel your question, press star followed by the number 2. One moment, please.
Okay, so the first question we have, does the frequency of blood draws differ to different types of athletes, for example, triathletes?
I think Liz, I'll take this one. I think the number of draws and the timing of draws is largely dependent on the competitive calendar. And so ideally, right, we want to be able to time the point at which we obtain this blood biomarker data when we have shifts in training to provide us feedback on the quality of that training and the potential adaptations to that previous training cycle. And so with triathletes, I know, particularly for the Ironman triathletes, they might start training in January or February, and then hopefully if you qualify for Kona, you're competing mid to late October. And so when you look at your competitive schedule there, you might only need 4 blood draws, depending on how your micro and meso cycles are scheduled. And so a lot of times when, and this is an exercise that we did with the U.S. rowing team, we sat down with our annual training program and identified for us what the most important stages of training were, where we needed additional insight to help us develop, again, effective training programs going forward. So if you've got a very long training season, maybe you're looking at 6 draws per season. But if you've got a shortened training program, or if you have a very long mesocycles, you may be able to get away with as few as 3. But I think it would be sound advice to have a really good, well-controlled baseline blood draw in a well-rested state, so usually before you start your high-volume base training, and then implement additional blood draws as training phases shift. And then the other one that you would certainly want to have is a few weeks out from your major competitions. And there may be only one major competition, for example, Kona World Championship race, or you might have another 1 or 2 A-list competitions. But have those other blood draws several weeks ahead of that competition, so you have that objective data to make modifications to your training and nutrition plan, such that when that primary competition is going on, you can have a good, sound mind knowing that you're well prepared for that.
Okay, so we have another question from Michael. What cut points are used to flag an athlete against her individual results? 1 standard deviation, 1.5?
This is a fantastic question, and I don't know if anybody has an answer to yet. It's one of the objectives that we've had is to identify some athlete-specific blood biomarker cutoffs, much like there are laboratory cutoffs for most of the blood work you would get at a hospital or when you see your physician. Those laboratory cutoffs are for sedentary average adults. And athletes, especially well-trained athletes, while we're still adults and or younger, we're different because the stress of exercise that we employ on a daily basis creates a really unique phenotype. And so that needs to be represented in how we interpret blood biomarker data. And there have been a few decent reviews out there that have purported different ways to interpret some of this blood biomarker data, but none of them are definitive, and none of them have really demonstrated that they're the best way to analyze it. And so with that uncertainty in mind, largely what we've done is use what I call the spider web approach, is we try to collect as much objective data as we can, and we also include the subjective data from the athlete and try to make some connections and triangulate the data. And if we have enough data that are suggesting an individual has an appropriate nutrition strategy, that they're healthy, or that they're maladapting to the current training and nutrition plan, it's that triangulation of data that provides us the confidence with the interpretation of the blood biomarker data. But the important part is that we need that array of objective, trustworthy information to do that. There's not one metric of internal or external load that is predictive of non-functional overreaching or overtraining. In fact, when you read the literature, it can be quite confusing to try to pinpoint blood biomarker responses and whether they're predictive or indicative of overtraining or non-functional overreaching. And I think that just represents the individual nature of athletes and how stress, both real and perceived, is unique and is precipitating some of these situations. And so the interpretation of the blood work is an acknowledged challenge to this endeavor. But the way we've approached that is, again, to use that spider web mentality. And actually our lab, in concert with Quest and U.S. Rowing, are looking at current novel approaches to interpreting the data. And so we hope to have those results out as soon as possible. But that's a great question.
Thank you, Luke. Thank you, everyone, for your questions. I just want to check in with the operator real quick to see if there are any live questions.
Speakers, there are no questions in queue at this time. Again, if you would like to ask a question, please press star followed by the number 1 on your phone and record your name clearly when prompted. To cancel your question, press star followed by the number 2. One moment.
Thank you. Okay, we have another question for Luke and Liz. After making adjustments to diet and lifestyle, how long does it typically take before you see an improvement in the athlete's biomarker levels and their overall health?
I would say that that's definitely dependent upon the athlete, and it's also dependent upon the biomarker in question. When an athlete is non-functionally overreaching, it tends to take weeks to months for them to return to their previous levels of performance. if they enter into an overtraining category, then it can take months to years. What we are typically dealing with, what I'm dealing with in the nutritional biomarkers is more related to iron status and ferritin. And in that, with appropriate supplementation strategies, an athlete's iron status can start to increase in as little as 2 weeks. With some other biomarkers, such as vitamin D, it may take a bit longer, like several months. But if the athlete isn't optimizing their nutritional practices or their supplementation strategies, it can take longer than that as well. So again, when it comes to anything biomarker related, and part of the strength of this is that we're able to individualize and be prescriptive with each athlete, and they can see how their behaviors are impacting the ability for their blood biomarkers to rebound and how their training habits are impacting that as well. So there's no one-size-fits-all that we know for certain, and it's definitely exemplified in the blood biomarker testing and in the protocols that we have for following up. So getting to know the athlete on an individualized basis is really critical for this.
Thank you, Liz. We have another question that came through the chat. You mentioned player buy-in and discussing the value of biomarker data with the athlete. How do you present this value to the athlete?
That's a great question. For me, I'm fortunate in that the rowing community specifically, they tend to be extremely inquisitive. They also tend to be very smart, and they really want to understand what these things mean. So I find that in getting them to buy in, it's really my ability to break down what hemoglobin is, why it matters, and why ferritin might be related to the way that they're feeling in training, the way that they're feeling during their intense aerobic workouts. Really being able to kind of tie those pieces together and explain it to them in a way that they're willing to receive it. I think with other athletic populations, maybe with younger athletes or athletes that just aren't as, that don't have the level of education that an elite rower tends to have, explaining it in a simplified way that's easy for them to understand is the best way to get buy-in, and then doing it with regularity. Really, again, having this Blueprint for Athletes program and being able to measure the change over time can really help an athlete to link together the biomarker and how they feel, and if they have an improvement in the way that they're feeling and the biomarkers are shifting, then that is really the best way to show them how meaningful this data is.